you're debating between starting a home health therapy business or a mobile outpatient company, this video could save you from making the most expensive mistake of your career. I'm Pevnick, and I built a home health therapy company that collected over $13 million before I sold it. But here's what most people don't know. I actually ran two different business models for 2 years. One made me financially free, the other nearly broke me. And in the next 7 minutes, I'm going to show you the 4 critical differences between these models that every therapist needs to understand, because one of them requires you to work twice as hard for half the money, while the other can scale to 6 figures a month without you seeing every patient. And by the end of this video, you'll know exactly which model to avoid and which one can actually give you the freedom you went to school for. And if you stick around to the end, I'll show you the real numbers that made me kill one side of the business completely. So if you're tired of being underpaid and overworked, and you want to build something that actually scales, keep watching, because this video could change everything. So let me start with the biggest difference that most therapists completely miss: the payment model. And when I show you these numbers, you're going to understand why I was so frustrated with Outpatient Mobile. With Outpatient Mobile, you're using Medicare Part B, the exact same billing system as if the patient walked into an outpatient clinic. That means you're billing in units. And here's where it gets ridiculous. Most companies will bill 4 units per visit, which requires 53 to 67 minutes of treatment time. So you're spending about an hour with each patient, plus your drive time between patients, and you're getting paid the same or often less than what you'd make on a 30 to 45 minute home health visit. And I'll give you some real numbers here. So when I was running Outpatient Mobile, we would typically get $123 for a 4-unit follow-up that lasts 53 to 67 minutes long. But in home health, I was getting $120 for a 30 to 45 minute follow-up. Do the math. That's nearly double the hourly rate for home health. And that's before we even talk about the other headaches and expenses I'm about to share with you. This is why when therapists ask me about Outpatient Mobile, I tell them, you're literally working twice as hard for half the money. And if you care about making more money and having more time to spend with your friends and family, it's black and white. Outpatient Mobile is a business model designed to keep you broke and burnt out, because it's the exact same payment model as an outpatient PT clinic, where therapists these days are seeing 20 patients a day for a salary that can't even repay student loans. So our second point is going to be around patient acquisition. So let's talk about how you actually get patients, because this is where Outpatient Mobile becomes a full-time marketing job that most therapists hate. With Outpatient Mobile, you have to find every single patient. You're dropping donuts at doctors' offices, you're begging for referrals, you're attempting to build relationships with physicians who frankly don't get paid to refer to you, so they don't really care. Now, what we found was the insurance rates were so low, we couldn't afford to go in contract with a single insurance. Most of the insurance rates were less than what we paid our therapist to do a home health visit. So we only could do Medicare Part B, which means if you need more patients, you're likely going to need to advertise online, maybe paying for Facebook ads or Google ads. And then you need to sell patients one at a time, convincing them why they should choose you over going to a clinic up the street. And here's the brutal truth. Most therapists hate sales. We didn't go to school for 7 years to become marketers. We want to treat patients, not spend our Saturdays at health fairs stretching people for free and trying to drum up business. Now compare that to home health. With my model, I just needed to find the right agencies, ones that actually had a lot of patients in the areas that my therapist and I wanted to treat. I'd set up contracts with those agencies and they just send me patients all day long. Now the agencies are already doing all the marketing, all the doctor relationships, all the hospital partnerships, and they have way bigger marketing budgets. So I just needed to position myself as their go-to therapy partner. That's why my company ended up contracting with over 300 agencies, because I didn't want to chase down individual patients. I was partnering with organizations that already had hundreds of patients who needed therapy. The third biggest difference is credentialing, and this one was probably my biggest personal headache when I was doing Outpatient Mobile. With Outpatient Mobile, both your company and every single therapist you hire needs to get credentialed with Medicare Part B. Do you know how long that takes? Do you know the paperwork? It's absolutely insane. Do you know how many times I asked the therapist to send me a copy of their diploma, and they told me they didn't know where it was or it was at their mom's house? It was a nightmare. And every time I hired a new therapist, I had to go through this frustrating process all over again. And every time they decided to move or quit, we'd have to start the whole credentialing process from scratch. Now with home health, you know what I had to do? Nothing. Zero credentialing. The agencies are already credentialed with Medicare and insurance. When I contract with them, I'm just providing therapy services to their patients. I don't need to credential my company or my therapist with insurances or Medicare. I just needed contracts with the agencies, and I was in business. That's it. This alone probably saved me hundreds of hours of setup time and thousands of dollars in administrative costs. And that brings me to the fourth and final difference, which is billing. And this is the one that really concerned me. With Outpatient Mobile, since you're credentialed directly with Medicare and insurance, you are the one responsible for the complicated billing. Medicare Part B billing is no joke. There are modifiers, prior auths, documentation requirements. It's literally a full-time job, which is very difficult, especially if you're still seeing patients or running other aspects of the company. Now, most companies end up hiring a billing service to handle this. And when I was doing Outpatient Mobile, the billing company I used took 7% of revenue, not profit, revenue. So for every $100,000 that we brought in, they took $7,000 right off the top before I paid any expenses. And even with that expensive billing service, it would usually be 45 to 60 days to get fully paid on these claims. Sometimes longer if there were denials or appeals or they needed more documentation. And that creates serious cash flow problems when you're trying to pay therapists and grow a business. And that was really concerning to me. Now compare that to home health. I invoice the agency a flat rate per visit and I get paid 7, 14, or 30 days, depending on our contract terms. That's it. No billing company, no Medicare headaches, no waiting 60 days to get paid. Agency handles all the complicated insurance and Medicare billing. I just send them a simple invoice like any other business-to-business transaction. And this is why after 2 years of running both models, I killed the Outpatient Mobile side completely. Home health was simpler, more profitable, and way more scalable. I'm not saying Outpatient Mobile can't work, but as someone who's built and sold a multi-million-dollar therapy company, I can tell you which model actually scales without driving you crazy. Home health gave me the freedom to step out of patient care, hire over 650 therapists, and build something I actually enjoyed. The Outpatient Mobile side was just a constant headache that ate into our profits. So if you're thinking about starting your own therapy company and you want to learn how to do it the right way, the way that actually scales, I've got a link in the description for a 100% free strategy session. We'll go through your specific situation and I'll show you exactly how to build a home health therapy company that can hit $20, $50, $100, or even $300,000 months without you having to see every single patient. And if this breakdown was helpful, click that like button and subscribe so that you see my future videos. I've got a lot more home health therapy strategy content coming that could save you years of expensive mistakes that I already made for you.